Welcome back. Every November, we celebrate National Family Caregivers Month, a time to honor people who provide care to older or disabled adults and their family. Joining us now is Burlington resident Abby Palazza, who is a caregiver for her father. Thank you for being here.
Hi, thank you.
So first, tell us a bit about your experience as a caregiver. How did it begin?
I think that my story first begins when my dad was diagnosed with younger onset Alzheimer's disease my freshman year of college. And he was diagnosed with this at the age of 50. My true caregiving journey, however, doesn't really begin until the following spring when I sought to pursue my license as a nursing assistant. I was kind of drawn to working in the memory care center due to my dad's diagnosis, as I was more eager to learn about how to relate and work with people with dementia. And so this led me to pursue working in memory care per diem while I was pursuing my college degree at UVM. And since then, as my dad's diagnosis has progressed, I've adopted more of a caregiving role at home as well with my mother.
Obviously, most people, I think when they think of Alzheimer's diagnoses, they don't think of someone who's in their 50s. Was it a shock to you to have your dad diagnosed at such a young age?
Yes, it definitely came as a shock. I don't think it ever really prepares you, and things happen so fast. But definitely after receiving that, we all kind of had the mindset of what now? What are we going to do to keep moving forward and just keep living and having our best life? And while that shift from what it looked like even 2 or 3 years ago, I can say that we're still doing that today.
So what does being a caregiver entail, and how does it differ between, various conditions, for instance?
Yeah, I think caregiving for people with dementia is fairly unique just because of the changes that occur with the disease and how, while human emotion is kind of there, how someone is able to express themselves can differ. And this is especially challenging for family caregiving when you've have a relationship with this individual for some time, and now what you know this person to be or act has shifted in a different way. And coming in as a formal caregiver, you're meeting this person where they're at now. And so that's I guess a key, difference in how that goes. But definitely it's more of being a care partner than a caregiver. We often say, because you're partnering in someone to help them be as independent as they can and to help them live their best life despite the limitations or challenges that they may have. And especially working with people with dementia, that can mean also helping cope with difficult emotions and challenges that come with that.
And so what key advice would you have for caregivers or families in need?
Yeah, I definitely think, as we always say, is when you're caregiving for someone with dementia, you're on the same team as you should be, but you are the most adaptable player there is. And sometimes the other person isn't able to adapt like you are. And so that may mean that you have to meet the person in the same reality that they're in, or you have to give up the idea of always being right. And this can be certainly challenging. And so in terms of self-care for caregivers, I often stress kind of finding time where you don't have to be adaptable and you can fully do what you want to do in that moment. And so sometimes that doesn't always look like the normal self-care rituals that we always talk about. And it can look like just cooking a meal by yourself for someone, or going for a walk, or doing something where you can do what you want to do without having to, change that for someone else.
And how can people support the caregivers in their lives?
Yeah, definitely supporting caregivers is just constantly checking in and asking how they're doing, but also just being there to support their person that they're caring for, or their care partner that they're working with, and constantly being there for when they are struggling or need someone to talk to, and also just being a presence and kind of carrying on life as normal. I feel like when you receive a diagnosis or in this position, it can feel like your whole life shifts. And so having some sort of normalcy with your friends or families and those interactions can be really meaningful.
Mm-hmm. And we will have more information on our website. Abby, thank you so much for the time, and good luck.
Yeah.